Hello there, good evening. The Health Secretary Jean Freeman has defended a policy which will allow hospital patients to be discharged to care homes before they've tested negative for COVID. Opposition politicians see the guidance could cost lives, but the Scottish Government says it will only be allowed in exceptional circumstances. David Cowan reports.
In the first weeks of the pandemic, dozens of patients who tested positive for COVID were discharged from hospital to Scottish care homes. An inquiry later found no statistical evidence that it caused any of the outbreaks that have killed over 2,000 care home residents. But many people are convinced it must have been a factor. On Thursday, an MSP asked if it was still happening.
Are we back now to a policy where we are discharging COVID-positive patients back into care homes?
There is not such a policy, and there will not be such a policy.
In a written answer to another Labour MSP, the Scottish Government said that everyone admitted to a care home should have had a negative test first, unless it was in the clinical interest of the person to be moved. It would be a clinically led decision in exceptional circumstances.
We should not be putting people with the virus into care homes with other vulnerable people. The First Minister said it wasn't happening and that it wouldn't happen. That was days ago. Now we learn it has been happening. It's like a game of Russian roulette with people in care homes. It must stop today.
The Health Secretary said it would only happen with the right precautions in place.
That will be a clinical decision made by the clinical team and the social work team that are working with that elderly person and their family. And it is entirely right and proper, I think.
But other opposition parties have attacked the policy. Donald Cameron from the Scottish Conservatives said it had the potential to be a disaster, resulting in the loss of more lives. The Liberal Democrats, Alex Cole-Hamilton, said the absolute protection policy announced in the spring had been downgraded in the face of known dangers.
You can see that there may be reasons, logistical reasons why somebody is not tested and decisions have to be taken very quickly, but I would only expect this would happen in a tiny number of cases.
With the second wave claiming the lives of more care home residents, any exceptions to the rules on testing will be deeply controversial. David Cowan reporting, Scotland.